Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hi, this is Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Thank you for joining us for this podcast series topic, Invisible Agony, Navigating CRPS and the Healthcare Journey. For this series, I'm going to be handing off the hosting reins to Jennifer McLean, our Senior Product Manager for Nursing. Jennifer, I'm passing the mic to you.
Awesome. Thank you, Candace. I'm really happy and excited to be here with you today. You and I have worked together for a while now.
We have.
So I'm familiar with your personal life and some of the challenges that you and your family face. So we're going to be talking about a fairly personal subject today. I'm really looking forward to delving in and learning more about CRPS. So this is probably going to be a little bit emotional.
Yes.
Just given how closely you are related to this particular condition. So I want to warn our listeners that there might be some, difficult conversations, and we'll get into them. But Candace, do you want to add anything to that?
Yes, I just want to add that one of the most difficult topics that we'll be talking about at some point in the series is suicide and suicidal ideation. So be careful if you have little ears around.
Great. Thank you. So start me off by helping me understand a little bit more about complex regional pain syndrome. Why should we be discussing this? What don't we know? And I'm guessing that's kind of a lot, everything,
right,
because I'd never heard of it before I met you.
Yes, it's very rare. It's a very rare diagnosis, and a lot of the information about CRPS isn't known. But really, what complex regional pain syndrome is prolonged pain. It's an excessive pain of what you would think would be about like what an injury would cause, and it is ongoing. And a lot of times, it's really hard. It takes a long time to get a diagnosis for CRPS, but it's a neurological disorder where our brain rewires itself to say that there's a traumatic injury. Typically, CRPS is going to be linked to a cause. The most common cause is a fracture, but it could be a sprain. It could be a strain. It could be surgery. Even just a minor traumatic injury that is going to set off this cascade of events in your nervous system. There are two different types of CRPS. There's a type 1, which is about 90% of your cases. And with type 1, no matter the test that you do, there is no obvious or seen neurological or like a nerve lesion or injury. And it was called, hold on, let me get it right. I always get the acronym wrong. RSD, reflex sympathetic dystrophy is what it used to be called. So a lot of your older physicians, older healthcare providers are going to know it more as RSD. Type 2 is there is an obvious lesion there. There is an obvious injury to the nerves. So you do have two different types. You might also hear it under AMPS, amplified musculoskeletal pain syndrome, which is kind of this umbrella term that you will also hear juvenile fibromyalgia come underneath that. But the difference between your AMPS and your CRPS is that CRPS is almost always linked to something, some type of injury.
Interesting.
Yeah.
So how much, and you might not know the answer to this, but how much more common is something like fibromyalgia compared to CRPS?
Overall, really, I can only speak to pediatrics, but AMPS in general is very rare in pediatrics.
Mm-hmm.
I see it more and more now because now we live in this population. Now I'm a part of it. You're in those support groups and say, it seems to me like, how is this rare? There's so many people that have it. But there's not. It's just that's now our circle. That's now our life.
So you said that it used to be known as RSD. Is it becoming more of a known condition now, or is it still really stuck in that RSD phase where it's not really up to date in terms of providers' minds?
It doesn't matter if you call it CRPS or RSD. It's still providers can go their entire career and never see CRPS or AMPS.
How much of do you know how much of the population has CRPS?
So there was 2 studies that I was looking at when we first started down this journey. And one of the studies said it's like hold on, I have the exact numbers, 5.46 persons out of every 100,000 per year. And then there was a study that was specific to the United States. And they said that annually in the United States, about 200,000 people are diagnosed with CRPS.
Interesting.
Yeah.
And how? Go ahead. Sorry.
I was going to say some of the other interesting statistics about CRPS is that it typically it occurs in women or girls. So 3 to 4 times more likely for females to have it or to develop this than males. There's also psychological factors that are being looked at as well. And a recent study found that if you have an anxious personality, you are more likely to develop CRPS. And if you are going through a time of like high emotional stress, it also plays a factor into whether or not you develop CRPS. And when my daughter developed CRPS was about 3 years ago. We're in our 3rd year of this journey. It was a time we're a military family, so we were given really unexpected orders to move, and we had like a month to find a place to live and to figure out where we were going. She was starting middle school, which is also a really hard time. And we were at camp, the same camp we go to every summer, and I donate time to the camp as the camp nurse once for a week, once a year. And she was running down a hill in northern Georgia. And, they have those big trees and those big tree roots coming out in the mountains. And she got her foot caught in one of the tree roots. And so when her foot went underneath the tree root, the rest of her foot went over. Ooh. And she got up and she went to go play. And she played for a while and she was running up and down the water slide. And there was this moment where, and this is, we'll come back to this to kind of talk about this moment, but there was this moment where she was running up the stairs again to go down the water slide with her friends, and something in her brain clicked and the pain was so intense, she couldn't walk anymore. And so they had to carry her to the infirmary. And I'd been, of course, the nurse for the whole time. And I walk into the infirmary. It's a Thursday. I've had no injuries. And there's my daughter sitting on this bench. So we took her to the ER, and they diagnosed her with a sprain. But we can definitely kind of come back to that, because that's just kind of part of our journey and our story, because CRPS is so rare that they say that the earlier the diagnosis, the earlier you start treatment, the better the outcome. But most people, it takes years to actually get a diagnosis.
And why is that?
Because there's no test to say that you have CRPS. It is a rule out diagnosis. So you're going to rule out everything that you can rule out before they're going to say, hey, you have CRPS. So you're going to have all of your radiographic scans. You're going to have that physical assessment. You're going to have all of those diagnoses that they're looking for, that they're watching for, before they finally come out and say, There's nothing else. All that's left is CRPS, and you have CRPS. So in our journey, go ahead.
I'm curious, given how rare this is, which also then there's this, it seems like there might be a self-fulfilling prophecy. It's rare, so it's not well known. How many people are actually living with CRPS that haven't been diagnosed because either they don't have access to the right care, or their doctor simply is just saying it's all in your head. You're making this up.
Yes. You will find that a lot of people who have been diagnosed with CRPS, they have had multiple physicians. They have had multiple diagnoses, and they have just been searching for help. Please help me. Please help me. The thing about CRPS that is really important to know is this is nerve pain. So the best way that I can describe it is your brain is, working through your nervous system, and it sends down a stimuli. It's just to say something that your body needs to do. And so normally when that signal goes to wherever it needs to go, so CRPS is normally found in an extremity. So hands, full arms, foot, and leg is typically where you're going to see CRPS. So when your brain sends down that signal, normally it's going to dissipate when your body is done with that signal. So it's like a drag strip. So it shoots down the drag strip, and then it dissipates and it goes away. Well, in CRPS, the brain does this weird rewiring thing, and that drag strip becomes like a NASCAR racetrack. And so that signal is constantly circling. It doesn't dissipate. And so the pain from CRPS is typically described as bone crushing, burning. It's deep. It's constant tingling sensations. My daughter describes hers as lava flowing through her veins. You might hear it described as tearing. It feels like something is tearing. Other people have described it as fire. I feel like I'm on fire. Because it's nerve pain, acetaminophen doesn't help. Ibuprofen doesn't help. Opioids don't help. So you live with this intense pain that doesn't stop. There is no known cure. There is limited evidence of any type of treatment that actually helps. And that's why CRPS is nicknamed the suicide disease. Because for many patients, that is the only way out that they can find. And part of that also goes with navigating the healthcare system. If you don't have the knowledge and that inside knowledge to know how to navigate or find what's available, and then you have all these physicians who have never heard of it, who think it's in your head, that is where a lot of your patients the path they'll go down. But there is some criteria. It's called the Budapest criteria, and it's signs and symptoms of CRPS. It is an international checklist, basically developed by an international consensus panel. So CRPS is known around the world.
It is. Okay. So we already talked a little bit about that some doctors don't understand it or don't know it. And this results in a long diagnosis process, sometimes never being diagnosed. What are some other misconceptions about CRPS?
Well, I think you're going to get to hear from my daughter in episode 2, and she's going to talk a lot about this. But one of the misconceptions is that you're a drug seeker, you're making it up. But even if we talk about treatment, and we can talk about treatment here in a minute, I want to talk a little bit in that area of even providers and how they treat CRPS patients and how they think that CRPS patients should live. Because yes, can we say that this pain is in your head? Well, it's your nervous system. You're constantly in fight or flight. Your body doesn't come out of that. If we go back to the signs and symptoms of CRPS, you're going to see the biggest hallmark is pain that doesn't match the injury. So Judah was diagnosed with a sprain. Okay, during our journey, we have had 11 x-rays, 2 MRIs, CT scan. We have had 3 to 4 ED visits. We have gone through 3 to 4 providers because of referrals and things. And we spent 6 months, not 6 months, we spent 6 weeks of immobilization with immobilization. And then we spent 3 weeks at a children's hospital for treatment. So we've had this really long journey, and she's still not in remission with her pain. So we're actually pursuing another avenue of treatment where we're going to have to go away for 3 to 4 months for a neurological rehabilitation program. But I remember the orthopedics. So we started out with, going to EDs, and they're like, oh, it's a sprain. It's a sprain. We ended up with our primary care provider, who sent us to an orthopedic, who sent us to a pediatric orthopedic surgeon, who then sent us to a rheumatologist who was backed up 6 months. And so this orthopedic surgeon was amazing at Champion to get my daughter to Philadelphia for treatment.
Mm-hmm.
But I remember it was the last time we saw him. We had an x-ray, and he was getting ready to discharge us. And he said something to Judah, and she realized that she wasn't going to see him anymore. So she asked the nurse, can I see Dr. Wilson again? And he came back and sat on the bed. She said, thank you so much for trying to help me. And I could see his entire face just drop, and he looked down at his hands, and then he looked back up at us, and he said, we're going to do another MRI, because he wanted to fix something. He wanted to find something to fix her. But we didn't know that she had a break until we had the very first MRI. Her fracture was so minute that it showed up on no x-rays. It only showed up on an MRI. Her pain never matched her injury. And when I say her pain didn't match her injury, I cut off two splints because she was screaming.
Oh my gosh.
Yes. And that's why we had 3 or 4 ED visits, is because her pain was so intense that me as a healthcare provider myself, I was like, this is not a sprain. We're weeks out of this. We're months out of this. Why are we still in this?
Even a break,
not adding up. Yes.
Yeah. Even a break it's painful. I know I have one right now.
Yes. Yes.
But it's painful, but it doesn't last for weeks and months. It
doesn't.
It's not scream worthy. That's
yes.
And it blows my mind to think, like, a lot of, that there are providers who think you're looking for drugs. Well, Judith, this happened when she was 10.
Yeah, somewhere between 9 and 10. I think it was the year she turned 10, so she was still 9 when it happened,
so
and
she's
she
just
turned
a little kid.
10.
So how do doctors, how do some of these providers interact with you? Because she's 9, she's 10, she's not looking for drugs. Did anybody accuse? And we can talk to Judah about this too. I'd love to hear her perspective. But did they just treat her like she was an attention-seeking child? Did that?
No, we didn't have that, thankfully. It was more geared towards me. I took her to one of the EDs, and it was the ED where our original primary care provider was. And he accused me of taking her splint off, which I have taken her splints off. But at this particular moment, we didn't even have a splint yet. His office didn't give us a splint. We had just seen them earlier in that week, and her pain was so intense that all I knew to do was to take her to the ED. So when he comes walking in, he's like, well, where's her splint? And I was like, you didn't give us one. You didn't give us anything. And so it was more kind of geared towards me as a parent, and not towards my daughter in those moments, which also makes you feel intimidated. I didn't feel intimidated because I had the knowledge and the background to, I don't want to say fight back, but to just say, I'm not stupid. I know what's happening. I know what's going on.
But that is the advantage of you and your
Yes.
professional background that a lot of people wouldn't have. So I can't even imagine being a parent just a typical parent who doesn't have any healthcare background. Like that must be really difficult.
Well, and CRPS there are symptoms, so we talked a little bit about how the number one, the hallmark is how pain is so bad, it doesn't match the injury. But you also have sensory changes, specifically allodynia is what we call it, but it is where stimuli that normally doesn't hurts. So like, for example, taking a feather and just kind of like slowly, just very lightly rubbing your arm wouldn't hurt you, right? It doesn't hurt.
Right.
For someone with CRPS, you would think you had needles and you were like jabbing it into them. So sensory changes is another, but you also have skin and temperature changes of the skin, as well as color changes. So it started off for us, and it can go it can go any way. But ours started off as warm and red and swollen, and then eventually went to cool, cold, pale, and bluish. So really, this is where that traumatic, like where your brain has made that flip to be traumatic. And so it was like, oh, wow, okay, we've had a traumatic injury. We need to work on healing it. So, you're going to send more blood to that area. And so that's that warm red and the swelling that you see. Well, then over time, it's like, whoa, hold on. We still have a traumatic injury here. We need to slow that blood flow down. So that's why you get the cool and the pale and the blue. It is literally slowing down the blood flow to that area because your brain thinks there's a traumatic injury here. And that hurts. Even that alone is painful. Yeah. It's like, you take it and you squeeze right here, and eventually it's like you get that tingling and it starts changing colors. You don't have to do that with CRPS. Your brain does it all by itself. And you have no control over when it does it.
So there's just the pain of the syndrome itself. And then there's the pain of healing when your body is like, I'm going to heal this because healing hurts.
Yeah.
Again, I have firsthand knowledge of healing hurts sometimes.
It does. So then we have like some motor issues. One of the hallmarks for my daughter right now that she still deals with is her ankle locks up. It'll just lock up and she'll have to sit there with her ankle in her hands and twist it and move it around to try to make it so that she can walk better again. A lot of people with CRPS will stop using that extremity. So they will end up with muscle atrophy, which she has. They will lose function, the ability to use that extremity the way that it's supposed to be. And the pain will spread. So hers started in her foot, and it is now, we're in our third year, it has moved up to her leg, all the way up to her leg, all the way up to her thigh. We also currently have identified that she has some on the top of her scalp now. So me trying to brush her hair is painful. Because that's your nervous system. We have an issue with our nervous system. So
is her pain constant and her pain, or anyone with CRPS, is it a constant pain, or are there ever moments of relief?
She has moments where the pain is down, but she doesn't have moments where the pain is gone.
Yeah. That's a tough life for a kid. I mean, anybody, but my gosh.
Yeah. We were talking to a physician to get accepted into their program that we're going to be going to soon. And one of the questions they asked her is, if you could rate your quality of life on a scale from 0 to 10, with 0 being death and 10 being amazing, where would you rate it? And she rated hers at a 5. And she just turned 13. Yeah.
I can't imagine as a mother how that must hurt to hear.
Yeah.
And approaching this as both a healthcare professional and as a mom, like, take the mom side out for a second. And as a healthcare professional, like, how would you approach this kind of patient? And have you been approached in your treatment, in your interaction with providers that way? Like, what would you do? And have you seen that?
So my background is adult critical care. And so I've seen a lot of fibromyalgia. I haven't seen anybody with a diagnosis of CRPS, but I think that fibromyalgia for adults is probably about, some of them could probably have been diagnosed with CRPS. It is that neurological breakdown, basically. You're always in fight or flight. Your body cannot get out of fight or flight. But what I have found with my daughter is when I go to our primary care provider, he doesn't know what to do. Right. And he will give me whatever I want, but I have to go and find it and research it. One of the things, and I'm grateful that he will help me and he will get the referrals that I need. But it's hard because he told me at our last appointment, he said, I know she needs a specialist, but I don't know who it needs to be. And so that's when I said a rheumatologist is typically who follows this, which is also very strange. Why rheumatology is, usually who you find that's going to follow this. So he's, tried to put out referrals for neurologists, which is great, rheumatology. But one of the biggest things that we started early on was physical therapy before we even started at the hospital that we went to. So we've kept her in physical therapy because she did start to lose function. Her muscles did start to atrophy. But so many kids, so many adults with CRPS, they will move through crutches, a wheelchair, and eventually become bedridden because the pain is so bad. And I don't know if I said this, but for the pain, did I say how bad the pain was on the pain scale? Because I can't remember if I said that.
You didn't mention the pain scale. I think that would be a good point, actually.
So on the pain scale, CRPS, the pain from CRPS is rated to be higher than amputation without anesthesia and childbirth. Which is, again, it really kind of goes to play into why this is considered a suicide disease. I know, it makes me really teary to think about that.
Yeah.
Because one of the things that I hear a lot of is, Mom, it hurts, and I can't fix it for her. And being, a healthcare provider myself, I've gone to school a lot, and looking at all of those, I can't fix my daughter.
Yeah. And as a mom, and a healthcare provider, because healthcare providers, they do want to fix, they do want to help. That's why you're in it. But my gosh, your own kid too, like you're playing double duty on this one. And I would imagine that the emotional toll must be even more so as a result. We've actually come to the end of episode 1 already. I hope everyone will join us for episode 2. We're going to talk a little bit more about navigating the healthcare system and some resources and support. And most interestingly, we're going to talk with Judah, your daughter, and hear her firsthand perspective on living with CRPS. So thank you everyone for being here for episode 1. And Candace, this has been incredibly informative, and I really appreciate you sharing your story. And
thanks. And thanks for being an amazing host and being willing to do this with me.
It was my honor and pleasure.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.